please welcome the Honorable Lourdes A. Leon Guerrero, Governor of Guam, Nagahagan, Guam, and Linda Impinko Denorsi, Director of Public Health and Social Services, as well as Dr. Felix Cabrera with the State Surgeon Cell and Physicians Advisory Group. And now on to Governor Leon Guerrero for her opening remarks.
Thank you, Janella. Half a day, 40 days ago on March 14th, I declared a state of emergency in response to COVID-19 prior to our first confirmed cases. 38 days ago on March 16, I instituted a mandatory quarantine of all individuals entering Guam, 10 days before Hawaii issued a similar order. And 18 days ago on April 3rd, Governor Ige of Hawaii told state media what we on Guam already knew. The FAA would not close federal airspace. A little more than a month ago, on March 19th, the social isolation directive was implemented, closing all non-essential businesses and prohibited any form of large gatherings. This order came before California, New York, Hawaii, and Texas issued theirs. And while we must always remain vigilant, Guam's sacrifice and strength has yielded positive results. Full recovery will be gradual and slower than any of us want, but it is based on science, evidence, and sound medical advice. Through this method, our known case fatality rate is 3.6%. This rate, used by Johns Hopkins University, is calculated by dividing our number of known COVID deaths by the overall number of known COVID cases. This means that for now, based on actual data, what we have done is working, making us comparable to Germany and lower than the United States, two of the most industrious countries in the world. There is light at the end of the tunnel. I know that some in our community have argued that initial projections predicting a mass fatality rate of 3,500 souls on Guam was wrong. We are all grateful that it was wrong, but none of this was fate. It didn't happen solely because we wanted it to or because nature was left alone to run its course. Lives were saved because we stayed home and stopped the spread. My physician advisory group is here to present an updated model and potential plans to expand our present testing criteria. Our new trajectory has us flattening the curve with a slight peak later in the year. This gives us time to increase capacity at the hospital and prepare for any surges of new cases. But remember, this model is based on our current measures to mitigate the transmission of the virus, and any changes we make will potentially change our trajectory. Anytime we loosen restrictions, we are also lengthening the time of our social isolation directive. From the start of this crisis forward, each of us has the tools we needed to combat COVID-19. Whether or not we find ourselves in this fight against 2 weeks or 2 months from now will largely be dependent on how we behave. I'd like to turn to Linda now to give us an update on our COVID.
Thank you, Governor. As you know, we have our dashboard located at our Department of Public Health and Social Services website. You just log into Google and type in www.dphss.guam.gov. And right now, we still stand at 136 COVID positive cases. We have an additional 5 more individuals that fully recovered, bringing our total of recovery to 119 patients, and of course, 12 currently active, still in recovery phase, and 5 have died. In regards to our whole COVID breakdown of 136 positive cases, 18 are travel related and 118 are not travel related. Of that 118, 36 are household contacts, 13 are community contacts, 19 are healthcare contacts, and again, the breakdown of that 19 is 5 as a patient, 14 as a healthcare worker, and 50 nothing reported in regards to contacts. The update for our quarantine sites, we currently have 203 individuals still in our Government of Guam quarantine sites. As far as those that have been released from quarantine, completing their 14 days of quarantine, as of yesterday, April 21st, we have 1. So altogether, from April 2nd through the 21st, we have a total of 355 individuals that have cleared through our 14-day quarantine. And right now, we have 7 in our isolation facility. Thank you, Governor.
Thank you, Linda. I'd like to ask now Dr. Cabrera to share with you information about our current actual data and also trajectories and what our testing strategy and goals are. Dr. Cabrera.
Thank you very much, Governor. I'll go ahead and share my screen here. All right, good? Okay. All right. So this here is a public briefing on COVID-19 unified response efforts, mitigation review, trajectory update, and testing goals by the Governor and State Surgeon's Physician of Adelup. So we'll start out with this slide first, which shows the relationship of all our mitigation efforts and COVID cases here on Guam. So here you have a accounting of all the different dates of different events that occurred over the past almost 2 months now, starting with when we did our initial Guam pandemic plan review to when there was a declaration of a state of emergency by the governor, our first 3 positive COVID cases, and so on. I would like to take time to highlight the 4 items here. Now, these are what's very well recognized as the key government mandated social distancing measures. And that's the educational facilities being closed, travel severely limited, stay-at-home order, and non-essential services closed. And basically, within about 5 days, all these 4 items were enacted. What you see next to each event here is just a visual bar graph that shows 2 weeks out from when that occurred. Because typically when there's a mitigation event that occurs, you may see that in results about 2 weeks later. So superimposed here is the graph of our total COVID-19 cases. This is in yellow dots here is the cumulative number. In the purple bars here, you see the COVID admitted patients. And then the green line graph is the total number of new cases per day. And of course, very nicely, we can see that there's been consistent in nearly 0 cases for the past over a week now. What you also can notice visually is that once we enacted all these mitigation efforts, almost about 2 weeks right after that, that's when we started seeing our decline. So the take-home message from this slide is that mitigation works. And we are successful in suppressing a major surge because of everyone's actions and because of the leadership of our governor and public health in their efforts, and everyone doing this in complete partnership. So I think it's important that we recognize this achievement, but the reality is that we still have a lot of work to do. So when we think about the graph here, what does it mean in terms of the scale of what things will look like over the next 6 months or so? So what I'm going to show here is Guam's COVID-19 hospital census projections if current mitigation is unchanged for next 6 months. So it's not only that we wouldn't change anything that we're doing in social distancing, but it's also if we did increase our testing capacity and ability to isolate positives. So we didn't improve overall as well. And if that happened, then this is what the trajectory would look like. And so this is a trajectory that was created by the Guam State Surgeon Cell, utilizing UPenn School of Medicine's CHIME-SEER calculator. And as you can see, this is the hospital census in the purple, ICU census in the blue, and then ventilated census in the very light blue. The red represents the hospital threshold in terms of capacity. The key thing in understanding this is that we have significantly flattened the curve with our efforts. However, even this course is not completely flat. Thus, a surge still looms in the distance. Albeit now a much slower surge than previous projections, the threat to overwhelm our hospital system could occur in the fall. We must understand that short of an available and effective vaccine, a surge will continue to be a threat. As with other projections, this trajectory is not a forecast of our fate, but yet another recon report of our enemy. The key to winning this war against COVID-19 is the expansion of testing capacity in a responsible and strategic fashion. By doing so, our targeted search and destroy strategy can become even more effective and of better quality. We have passed the initial phase of a conservative and blanketed approach, which was necessary at the time. Additionally, we must take advantage of the time the enemy's retreat has allotted us to improve on many other fronts. By doing so, we will not only flatten the curve even further, but we will also develop a method to safely peel back some of our current safety measures. And to see what that will look like, we have another representation here of a trajectory. So what you see here is a basic flattening of the curve, even as it goes into fall. So this trajectory was adapted from FEMA's most recent model that they created in partnership with Johns Hopkins Applied Physics Lab, the CDC, and the Guam State Surgeon Cell. So as you can see, there is no threat to the hospital capacity on this trajectory. And this will be what would represent our best case mitigation over the next 6 months. With responsible and best practice ramp up of Guam's SARS-CoV-2 testing capacity and public health strengthening of COVID-19 positive isolation and contact tracing technique, we have the potential to keep this pandemic from exceeding our hospital system's threshold. In doing so, we can slowly reopen parts of Guam in a coordinated fashion. This can only occur with a well-defined plan with clear checks and balances. This is also another projection that was provided by the same by FEMA as well. And what you see now here is a worst case, fully unmitigated trajectory here in the dotted representation. And then of course, still it's the best case, fully mitigated, where you see that small bump in the fall over the next 6 months. So a clear and present danger will continue to lie in our midst. COVID-19 has the potential to resurge if we are irresponsible and reckless in how we reopen Guam. So now that we're in this new phase, in thinking about the new testing mindset, previously our early phase, before we had adequate testing on the island, we advised the public that if you have mild symptoms, are without chronic disease, and not feeling super sick, then don't come in to be seen. Just stay at home and isolate. Assume you have COVID and do the best to protect others. Now we're in this new phase. And in this new phase, if you have any COVID symptoms, you must get tested right away. And so that's the key change in this phase here. So to explain that further, in entering this new phase, the priority for SARS-CoV-2 testing, local testing slots, i.e. the same day testing and results, will still be majority reserved for acutely ill patients seen in the emergency departments and hospitals, as they of course are still first priority. However, we have the addition here of all symptomatic patients that we need to test. So of course, any ill frontline healthcare workers and first responders, but also here, anyone with the following fever, cough, shortness of breath, sore throat, or disruption of taste or smell should present for testing at Tier 2 clinics. And here's a listing of them on the side here, which is the public health clinics, AMC, FHP, or SBA. There are more symptoms that you can add on to here, such as GI symptoms or cold-like symptoms. Now, for those who don't have symptoms, we still want to test a certain group here, but there's a priority listing for that as well. And so for number 3, it's asymptomatics who have close contact of known positive. Now, this is mainly household contact. This does not include somebody who had contact with somebody who had contact. It's only for those with known positives. Number 4 is very high-risk persons and their caregivers that are asymptomatic. This will be determined by the physician's advisory group and public health. Given the definition of this criteria will evolve over time. Asymptomatic frontline healthcare workers and first-line responders. And then lastly on this list is large family homes that house moderate to high-risk persons. Examples are multi-generational homes or multi-family homes. So these tests in the non-symptomatic will be included in daily local testing batches as capacity allows. Otherwise, they may be sent off island. So just briefly, I just want to mention what we are considering our minimum standard. It's with PCR, NAAT molecular test with US FDA emergency use authorization as being our minimum standard for providing clinical care. So goal number 1 in testing, we need to reach this goal of less than 10% test positivity rate. What this means is it's not a prevalence rate, but per the World Health Organization, countries should aim to have less than 10% test positivity rate. This will mean we are likely casting a net that's wide enough to catch any to identify all positives in the community. As you can see on this column on the right, New York City having about 55% COVID test positivity rate, which is quite high, but the rest of the country being 20%. In Guam, it's 13.5%, so we're not that far away from being less than 10% overall. South Korea, they are at 2% now, and that's over the past few months, but right now, currently, they're even less. Testing goal number 2, capacity to test 152 per 100,000 people in one day. To accomplish this, we need 2 things. 2A is basically machine capacity, and 2B is consistent availability of test kits and related supplies. So here, this is a reference from the New York Times, where they are quoting the study out of the Harvard School of Public Health, where they state that the level needed to safely reopen is that an area must have 152 tests per 100,000 people in order to do so. In this example, New Jersey is at 70, New York is at 118. So before I get to what we are in Guam, I just want to mention that for Guam, given our population size, that means that we have to have the capacity to run as many as 250 tests per day. So just to be clear, it's not that we have to run 258 tests every single day. It's that we need the capacity, because if there is a surge or a flare up and there's a cluster of positive cases, we need to be able to test. Because for every 1 positive that's tested, there's approximately 10 contacts that need to be followed and followed very closely and likely tested as well. In this diagram here, it just shows the evolution of how we're adding on online more testing modalities. Initially, we had the ABI 7500 that was at Guam Public Health. We know that averaged about 40 tests per day. We also have the Abbott ID Now ×2, which is at Guam Memorial Hospital and at Public Health, as well as the Guam National Guard having a biofire. And so that brings up our total capacity to 134 at this time. This is the other modalities that are going to be coming online very soon. The BD Max is already at GRC. It had its test kits arrive on Monday. Been undergoing its validation, so it may be ready to start testing even as early as today, but likely before the week's end. That would bring us up to 230 total test capability per day on Guam. And ultimately, in short order, we should be seeing about 382 total test capacity per day on Guam. Now, this is just the machine's capacity, and this is assuming full availability of testing kits and supplies, which we know that that's the real rate limiting step for testing overall. But we just have to make sure that we have the machines able to run it. And it looks like we're well on our way. So this is a busy slide, but I'll just point out here, it has a lot of the stuff on the previous, but right now you can say that we are at the 79 daily tests per 100,000. That's our capability. When it's all said and done, we'll get up to 225 daily tests per 100,000 at minimum. and with the expectation that we're probably going to add more modalities over the next few months. But given that, then we'll be well above the 152 mark that's needed and that's recommended for us to safely reopen. And that concludes my presentation.
Thank you,
Governor?
Dr. Cabrera. We're open for questions now.
Okay, we'll begin with KOAM, Master LaConcha. Nestor? Okay, we'll go back to Nestor. Pacific Island Times, Marvick.
Hello. Hi, Governor.
Hi, Marvin.
Hi, I'd like to ask about Guam's recovery plan. We have always known that tourism is a volatile industry, and this pandemic highlights that reality. And our local economies do not expect this industry to recover as quickly as we hope. So, as part of the recovery plan, have you identified an alternative driver for Guam's economy?
With our tourism, as you know, like you said, it is not at all functioning right now. Many of the federal funds that have been sent is to exactly stimulate our economy and rebuild it back. As you also know that our economies are dependent on tourism, it's dependent on local government spending, and it's dependent on federal government spending. So as a help to our economy, I know our federal government is pouring in millions and even close to 1.5 billion in areas of individual assistance for our businesses, and also assistance for small businesses in particular. So with the federal aid that is being pumped in, we'll be able to put that back into the economy, and also our local government spending, we can also put that back into our economy. In the meantime, our economic recovery group is really working hard to identify strategies and plans on how to bring back our tourism economy. Of course, it is very dependent on also the global and international situation. So if Japan continues to have COVID cases, they probably won't be traveling very soon. South Korea may not be traveling very soon. I think people are just wanting to stay home and make sure that this virus will no longer infect us. And tourism, military and federal spending, and local government spending, those are the three areas. And we're now looking really on local spending and the federal government to help us bridge our economy till we also then get our tourism industry up and going.
Okay, how about homegrown industry? Is there a plan to cultivate a new homegrown industry that's not dependent on outside forces?
Sure. I mean, all along, I think within the last 3, 4, even 5 years, we've been working at sustaining our own livelihood. Food sustainability is one of them. We've been working and giving a lot of help to our farmers. Also, our fishermen, we're looking at doing aquaculture, agriculture, boost them up. But these aren't up and as robust as, of course, our tourism industry. And we are working hard to make that and have a diverse economy to depend on. And I know telecommunications is another one. We also have our small businesses that, again, we are very much aiding and assisting in trying to get them up and going in a local consumer environment.
Thank you, Margaret. We'll go back to Nestor LaConcha with KOAM.
Governor. Hello, Dr. Cabrera. Hello, Linda. First question is for Linda. Do you have any more details on the pilot run for Saturday, and how important is that going to be in the expansion of the strategic testing?
Yes, just to give you some details, we already created all the requirements that we're asking for the people that will be tested, and those will be the individuals that have mild COVID symptoms. Some of these symptoms we've itemized include fever, chills and runny nose, sore throat, cough, shortness of breath, nausea, vomiting, also headache, abdominal pain, and we go on to the list, loss of sense of smell or appetite, congestion, fatigue, weakness, rash, and other. We also want to add on pre-existing medical conditions, and these include chronic lung disease, asthma, emphysema, COPD or chronic obstructive pulmonary disease, diabetes mellitus, cardiovascular disease, hypertension or high blood pressure, renal disease or end-stage renal disease, and also chronic liver disease, anyone immunocompromised. What that means, if they have cancer, if they have chemotherapy, they're lupus, or they have HIV, anyone with neurological disorders, hepatitis, also anybody that's a current or a former smoker. So we want to have both of these conditions, mild illnesses, as I mentioned earlier, and also the pre-existing medical conditions. Along with that, we're requiring our staff to make certain that the specimen that will be collected through a nasopharyngeal swab will also have a form that will give us detail as far as the background of the individual. Have they been also travelers, or have they undergone any other history of antibody therapy and so forth? That will be included in the specimen sample, and we're going to have two methods of testing. One method will be going around through a drive-through, and the staff, the nurses, will get the nasopharyngeal swab. The other would be walking in, just like a walk-in. The reason why we're having it at the Estumbo gym is because a lot of the targeted group that we're emphasizing on is living in areas, as I mentioned, that they don't have transportation. So we want to make sure that we cover these barriers to care. And so that's the reason why we want to do both the drive-through simultaneously with them walking straight up to our staff, and they'll have the nasopharyngeal swab. So we'll have three teams that will be working on this. The gym is ideal because also it's a gated, and we can control the traffic coming in and out. We also will have the tag. The tag will have her team with the National Guard to control the traffic, and also the security will be in place with our Guam Police Department. We'll also have the emergency response team there in the event anybody should have any emergency issues. And of course, one physician will be available during this time. We also have decontamination procedures. So we have to ensure that of course, our staff, our nurses will don all their PPE, and they will decontaminate themselves as they get in contact with patients. And so in a nutshell, we're also going to advertise it through the mayor, of course, and our staff. And that information will be disseminated to them. And we're hoping that this pilot project, which we're aiming to just get a small count to start off with, as it's called pilot, so that we can be able to identify these areas that they may not have presented themselves to the clinic, because again, as I mentioned, they may have no insurance, they may be uninsured, they may have barriers to care like transportation. They can't get to the clinic for whatever reason. They don't have a car, or they don't have anybody that can drive them. They can't take the bus or whatever. You know, we're doing social distancing. So these are the reasons why we want them in these pocket areas. And so by getting that type of information, we can identify anyone that could be infected, regardless of their ethnicity. And once we identify if there is an infection there, we then launch our team to begin the investigation, to do the contact tracing. So later on, when we know that this person is positive in the household, we can identify contacts, i.e. household contacts and close contacts, so that we also want to test those in the household with this positive person to determine if they, even though they're asymptomatic, we want to test them. And of course, we don't want everybody in the household. We want to make sure that there's no cross-contamination occurring so we can control the transmission of this disease. And by doing so, we will assess if they have a condition in their home that's suitable for all of them to live in. If it's not suitable, meaning you may have an elderly in that household with that positive patient, or another family member that has also comorbid conditions, we don't want all of you in that house. So what we'll do, we'll take out the person that is positive and put them in our government of Guam isolation area. And then from there, we move on. Sorry, that's a very long explanation. I hope it answers. Sorry. 9 to 12. Yes, the time is 9 to 12 on Saturday, this Saturday. Thank you.
All right. Thank you, Linda. Governor, questions for you. So you mentioned in your opening statement and that it's up to the community. It could be 2 weeks or 2 months. Do you foresee a possibility of opening in 2 weeks? And have you given thought to which businesses you would allow to open up first?
So these questions are being reviewed by our recovery panel advisors, Nestor, and it's very dependent on whether it's 2 weeks or 3 weeks from now. Is dependent on the data and information we are going to be getting in the next 2 weeks with our expanded testing. And so I mentioned yesterday what are the triggers, right, to indicate to start opening or start loosening some of our restrictions. And of course, capacity of the hospital is one. Its ability to be able to take care of COVID patients if we start seeing surges. The 14-day period, which is 14 days from the last case that you see or the lowest case, 14 days forward is where the time frame is being looked at. And then, of course, our capacity to test. I really believe that we will have all of these 3 criteria met. And we have to have these criteria met before we actually decide on opening. I would like to look at businesses first and maybe open also some selected public services with our government. And then we can go from there. And what we would do, Nestor, is as we relax our restrictions, of course, we're going to continuously be diagnosing, monitoring, isolating, quarantining, so that we can continuously be monitoring how our community spread is responding to the measures and the restrictions that are lifted.
Thank you, Nestor. Next is the point, Nick Delgado.
Today, so majority are waiting for next month for financial assistance to arrive, correct? I recall you guys saying that yesterday that most of that processes will begin to roll out, and we'll see those checks coming first week of May and depending on what program. But you must know, Governor, that many are already scraping at the plate to eat their next meal and on the brink of taking drastic measures to get what they need to survive, most especially those in the private sector who have negatively been impacted. They just need help. They need money, not next month, this month. So what else is being done to expedite that help? And do you think you will extend the public health emergency past May 5th?
Yes, I am very much aware of our situation out there, Nick, and I am very concerned about our people, of course. I'm very concerned that we keep them safe. I'm concerned that we keep them healthy, of course, and I'm concerned that they're able to provide for their families. And that's why we advanced the economic recovery program forward. We are also looking at speeding up our tax refunds because we still have those that would be available for our people. And of course, public assistance is there. And we've been tracking the public assistance volume and eligible people that are enrolled. And we have been seeing about a 59% increase in public assistance. That's your cash assistance program. That is your SNAP, because there is a cash assistance program through public health. We have a SNAP program, which is your food stamps, and of course, MIP with your health care and Medicaid also. So there are currently existing local government assistance to help our people. Additionally, Nick, with these people that already have approved with their paid protection loan program, those businesses can continue employing these individuals. So even though the business is not open, but you now have a loan with the paid protection program loan, then you can continue paying those employees so that they can continue to have the means and the income to provide for their families. And of course, you know, that program is such that if you, whatever percentage that you are using to, from your loan to pay for your payroll, that loan portion will be forgiven. And so it's really a method to give outright federal grants to encourage employers to continue employing their individual employees.
Stand by, Nick. We can't hear you. One
Okay.
second.
No, I'm here. I'm here. Hello.
Go
Can you
ahead.
hear me? Okay. Yeah, and so I guess it's just pretty much for those that apply, they have to be patient as well and wait for those processes to move forward. And so
And we also raised, I just wanted to let you know, we changed our state plan for these programs to increase our poverty level to 133%, which then would allow more people to be eligible.
great. Okay. And so my second question, we know that there's less than a handful of COVID positive patients now at GMH, none over at SNU, and all non-COVID cases going to GRMC. Yet GRMC staff, they're feeling like they've been forgotten about, telling me there's a threat to the safety of staff and patients at GRMC. Nurses are saying the nurse-to-patient ratio, it's alarming, more than double since this pandemic has hit Guam. Since the changes during the transition, the hospital is seeing a significant rise in rapid response calls, cold flu, and even deaths daily. So what is your response to the nurses clearly fed up that their concerns with handling of patient care is resulting in these negative effects at the hospital, and those same nurses who apparently tell me they aren't getting the same prices pay other healthcare workers are getting, want to know, will you be going to GRMC to address their issues as well?
So I don't really know the situation at GRMC. What you had explained, I'm not aware of.
Right.
Lillian is here for GMH, but the situation is with GRMC, and I know Dr. Cabrera is also with GRMC, but I just wanted to let you know that we are moving as many nurses as we can over to GRMC. We have our DOE nurses that are working with the seasoned nurses there. They are trained. So we're trying to get as many staffing to increase the staffing level to GRMC so that their patient to nurse ratio wouldn't be as much as what you had said. I don't know if that is in fact what's going on because I'm not in tune and I don't have the information, but maybe Dr. Cabrera can mention.
Sure. So Nick, let's start out with talking about what the state was 20 days ago, and that in a situation like that 20 days ago, GMH was in that situation and not necessarily GRMC. So what you're seeing here is a seesaw basically of COVID and non-COVID health problems on Guam. And so 20 days ago, we were seeing about our peak in terms of hospitalizations of COVID patients at GMH. and the nurses there were strained. There was support from GRMC to try and offload. That has occurred, and that's helped. Now we're seeing it swing the other way, and that this is really an issue that's very specific to patients not getting the primary care that they need for preventative measures to stay out of the hospital. So the increase in rapid responses and cold blues, those are because a lot of patients now are waiting and not seeing their primary care providers or reaching out to them and or being willing to go to the clinics. And that we're now seeing the ramification of that. So they end up showing up at the hospital very, very sick when they probably could have been taken care of in a more conservative fashion and them not being as sick. So that's put a significant strain on GRMC in particular, especially this past weekend. What we noticed is that the surge of non-COVID patients happened a week after Easter. So you can take what you want out of that, but that's something that we notice and that continues to be an issue. But we're addressing it because we are one team. GMH, GRMC, we are one Guam. We are one team here. And then with the support of public health and the support of Guam DOE in terms of the nurses and the other nursing staff that are available in Guam to help, we all have to come together and provide that support. We're very in tune with the challenges that GRMC has right now, but we're even more in tune with trying to understand what's going on with the rest of the community and how we don't just solve the problems at GRMC, solve the problems in the community. So we're begging all the clinics, the primary care providers, the podiatrists, what have you, reach out to your patients if they're not reaching out to you, and ensure that they're okay. Do what you need to do to see them, and going to see your doctor is considered essential, and that will be fine in essential travel. That's the one time you cannot stay home, and we need you to stay with your medical home. So please make the effort to see your primary care doctors. Thank you.
Right, but just to clarify, so what we're saying, what we're hearing from the nurses is the patient ratio being alarming, and in some instances, 12 patients to one nurse, only making it more difficult for them to keep up with care for each of these patients, and that's what we're seeing. The rolling effects could possibly be that rolling effect of.
There's no way that there's 12 patients to one nurse, and so that may be a nurse assistant or a nurse extender that may be having that extra strain, but that is not what that is not an accurate statement in terms of ratios. Are the ratios strained? Yes, they are, but not to that extent. So we're doing our best to support our nurses, our doctors as well are extremely strained. And so again, it's a collaborative effort, because as GMH has gone to the decompression, that's something where they've gotten their rest. And so the providers that can go between, we need to shift some of those resources, at least for now, to GRMC. So we'll continue to work on that.
Thank you, Nick. Next is PNC, Kevin Kerrigan.
Yes, good afternoon, everyone. Governor, I have a question with reference to a bill introduced by Senator Moreland today to launch a local unemployment program rather than waiting until mid-May for the federally funded program to begin. What are your thoughts on launching such a program along the lines of the locally funded one-time stimulus checks that you authorized last Friday for those most in need? Couldn't you do the same for unemployment?
Kevin, I haven't seen his bill, but whatever that is being debated or being introduced in terms of local unemployment programs, I think that they would also have to make sure that they have the appropriations to make it happen. So I'm sorry I can't speak more about it because I have not seen it, but certainly I will do as much as I can to provide for our people using local funds as much as I can afford it. And that's why, again, I did the advance of the economic recovery stimulus program.
Thank you, Governor. As a follow-up, I'd like to ask Dr. Cabrera about the projections You gave us a couple of scenarios for an extended peak out to September or October. I didn't notice any death projections in there. Why was that left out?
Yeah, because right now we're at the point, because we've done such a successful job in suppressing our first wave, so to speak, which hopefully is our last wave, that it's now very difficult to project that. And we're at the point where our mitigation efforts, we, in the previous slide presentation that was given, we had a way of kind of determining in a percent wise how much we've reduced the spread. We talked about 0%, 20%, 30, 40, 50, and 60. What we actually think we've accomplished is 66% reduction in the initial spread. And once you're that high, it's very difficult to once you've been that successful in reducing the spread, it gets much more difficult to start predicting death. And so because of that unreliable number, it's not included.
Thank you, Kevin.
Hopefully we have 0, Kevin. That's what we're gonna fight for.
Next is Guam Daily Post. John O'Connor.
Hello, Governor.
Hi, John.
Yes, ma'am. Thank you. So to go back on our hopes for our testing capabilities, I'm hoping you can provide me something of a roadmap of how we're going to increase our testing capacity. When it comes to purchasing test kits, will they have to go through an RFP or bidding process? Will you request for test kits from the military? And Governor, will you ask for the military field hospital supplies to be donated to GovGuam once the military no longer has use for them?
Yes, we are already in discussions about that, John, in terms of the military support. And we can go to their laboratory right now. Their capacity is not as good as ours, and I know that with all the testing that they have been doing with the sailors, that they were flying those test specimens throughout the whole world, and in areas that they have laboratories. So that's why they could then test those 5,000 sailors. They weren't doing it all here locally. Avro Minoni and I have been talking, and even the Indo-PACOM military leadership there, even the Secretary Esper from Department of Defense, and they have all reached out to me and to offer whatever they can in whatever area we need. And medical supplies, medical personnel, medical facilities, laboratory tests, and so forth. So yes, I have been reaching out to them. Right now, we really don't need the assistance, and I hate to say don't need, because I don't want to think that we will never need them, and that if we need them, it's not there. We do appreciate their offer, and they are going to be working very closely with us to make sure that they provide those. So they've already offered the hospital facilities, the temporary medical hospital tents that they're putting up. They're putting one in South Finnegadon, and they've already put one out near Naval Hospital. They have offered that they would leave those when they've stabilized the USS Theodore Roosevelt, and also that the medical personnel will stay on to provide us that care.
Thank you, Governor. So
Sure,
for the second question.
Address your testing.
Yes, we're getting most of our supplies from the US CDC. The Gene Expert, for one thing, we're having 2 separate shipments from. One is from the World Health Organization, in line with our Pacific Island Health Officers Association grant that we received. That one we're expecting 4,600 test kits with 4,600 nasopharyngeal swabs and a kit for the quality control. And the other supply for the Gene Expert machine is also coming from US CDC through the International Regional Laboratory. And so those are anticipated to arrive. On top of that, we are expecting the Abbott ID Now test kit cartridges And so when we added everything up, it totals to about 6,100 tests that we're anticipating. I know that the latest that I've gotten with the email is that the shipment is going to arrive on April 28th. So I'm crossing my fingers that it makes it in good shape to be here. And once we get that, that will be the start off of our continuation of all the outreach that we're going to be doing in line with what our mission is, along with what Dr. Cabrera said, that we're going to test also the frontline workers, the police department, the fire department, as well as the National Guard and all our workers up front. And that way we get a better perspective of the incidence and prevalence rate of COVID on Guam and the transmission. Have we eliminated the transmission? And have we achieved the goal of flattening the curve? Dr. Cabrera, would you like to add anything else?
No, I think that's perfect.
Great, thank you all. So the second question, and I want to refer back to one of the earlier questions regarding the economy. So notwithstanding the unfortunate circumstances at the Theodore Roosevelt, we do know that them being here plays a significant part in mitigating some of the financial impacts from COVID-19 shutting down the tourism industry. And Governor, you said before that the military will play a crucial part in maintaining our finances as we move through with this. So have you been in discussion with DoD officials or the Navy about any other ships coming to Guam, including the Ronald Reagan? And is that something that you are going to be pursuing?
I have not been in any discussions concerning those vessels.
Thank you, John. Pacific Daily News, Steve Limtiaco.
Yes, hi, good afternoon.
Good afternoon, Steve.
I just had another question regarding the Saturday's pilot testing at Estumbo. So will public health be testing people who show up from outside the Estumbo area? And also, will those tested ever see the results of their tests, or is this strictly for government, data collection purposes?
No, it's not just for government data collection purposes. Whoever tests, the format is that when you're tested, you get a result, and that result comes out of the lab. The laboratory will then notify the physician. The physician that orders it normally tells the patient. In this particular case, we will have everything collected, and the department, because they're taking the spearhead on this project along with the governor and the support that we have from the other government agencies, we will notify and get that to the patient. Absolutely. This is not just a government statistical study or any of that sort. We want to capture those patients that may be out there that are high risk, that may be infected, but they're not coming in to the community health centers or to the private clinics or even presenting themselves to the hospitals, whether it's GRMC or GMH. And so that is the reason we're identifying these small pockets where we may have infection and we're not aware of that infection. And that's very critical in order for us to eliminate the whole COVID transmission and the spread. We are trying to eliminate that from happening. And so we want to identify these areas that are very isolated. And again, these individuals are of high risk. They're very vulnerable because they lack transportation or the ability to seek or any medical care for that matter.
So again, but you're testing people only within the Estumbo area, or if someone comes from another village, they can also get tested?
This is a pilot project, and our focus is within that perimeter for now. That's not to say that we're not going to also continue to other areas. The goal here is to do this pilot project first. And then from there, our team will get together and we will then, and we're already starting to identify other areas, not only in the north, but also at the central and the southern. And also our health workers and our frontline workers. Did I answer your question?
Yeah, yes, you did. Yeah, I'm sorry, I was muted. So also I noticed you haven't talked about the GMH hospitalizations or people in the ICU lately. Are there any updates on that?
Yes, good
Yes.
update. I'll
Lots
have
of updates.
Lillian
I can
mention it.
Lillian can come in. Thank you, Governor. Okay, Steve, thank you for that question. The good news is there are no COVID ICU patients. They've recovered. Success stories, they have recovered, and so the two that were in the ICU as of this morning have been moved out of ICU. So no further ICU level of COVID patients. What's the census right now? 2 at GMH. 2 COVID patients.
Thank you, Steve. Ariana's Business Journal, Maureen Marikina.
Buenas, everybody.
Buenas, Maureen.
So we have had a lot of reader questions, and I'm picking 2 today that are very similar, that we've had a number on the same topic. So the first one, I'm just going to read. It's actually about forecasts, such as we saw today. So it goes, the last time we forecast a minimum of 135 hospitalizations and 15 ICU beds needed, so we locked down. There were only 13 hospitalizations and 2 ICU beds used. It was 900% wrong. We realize that most of the experts have been wrong, not just those on Guam, but now Stanford University said the assumptions being used in these forecasts may be off by 50 times or 5,000%. Then directly to the governor, can you please confirm or give us some comfort that you won't be relying on just forecasts for your decision-making to reclose businesses once open? Some people have suggested that if we roll out gradually enough, we can monitor actual usage plus respiratory outpatient visits that are a 2-week advance warning before positive COVID cases appear. Do you have any thoughts on that, or are you going to just rely on models again?
Maureen, I am not relying on models. I am relying on actual experience and actual data. My understanding, believe me, when I first saw this model, and everybody here can attest, I said, I don't believe it. I don't believe we're going to have 6,000 people that are going to be hospitalized, and I think there was like 2,000 deaths or something like that. And my understanding from Dr. Cabrera, and he can comment more on that, is in the beginning, there was no actual data and information to help us in a much more accurate, maybe, or reliable kind of projection. And so the academics, I think the academicians, then they just say, this is what we think is going to happen if nothing is going to be done. And based on their exponential spread that they're saying this coronavirus is, these are the numbers that they're seeing for Guam. And I said to Dr. Cabrera, I hope you're wrong. And Dr. Cabrera said, me too. I hope we're wrong, which is we're proving that it's not really panning out the way it is. So I'm not basing my decisions on those modeling. I'm basing it on what we are seeing, and I'm basing it on the success of our people, making sure that we continue on with the measures that we've been putting forward. And so if we continue on being very compliant and very adherent to our measures, I really feel very confident, Maureen, that we will continue with this slow trajectory. And additionally, the capacity that we have now with the hospital and the ability to expand our capacity with what we have in terms of local resource is very comfortable for myself. And I think the medical advisory people are also feeling a bit more, less stressed about the capacity of the facilities. our biggest stressor is personnel. That's our biggest stressor. And so when the military told me that they're willing to leave their medical personnel, that was a big consolation on my stress. So we are going to be working with them to help us in terms of our medical personnel need as we go along and see what our outcomes are with the expanded testing, Maureen, to see really how is the community spread out there. So those are the things that we're looking at. What the viewer was saying about the strategy on what to do to open things up, I think is what we are also planning to do.
Okay, thank you, ma'am.
Wait, Dr. Cabrera wants to add something.
Yeah.
Okay.
So, thank you, Governor. So you're hitting the key part here, but we have to all understand exactly what models and projections are used for in these trajectories. They are not forecasts. They're not meant to be forecasts. They are meant to be a trajectory of a range of possibilities of what we could be facing. And we want to plan for the worst so that we get the best, because if we just plan for the best, we're gonna get the worst. And so, everyone wants to play Monday morning quarterback now, and that's great. That's what I was dreaming of, a month ago, and that we wanted to ensure that those models didn't come to fruition. And guess what? It's because of all the work we did is why it didn't come to fruition. And if you don't take the time to really understand that and appreciate that and know that what we could do and what we're actually capable of is that we did not become Italy. We did not become New York City. And to think that that we would have just never have, that was never a possibility is completely naive.
Right.
And that that was a very serious risk. 25 patients at GMH that had COVID, that was a significant strain on GMH. And to insinuate in any way that the threat was not real is somebody who just lives in a shell and doesn't understand what's been going on in the globe. And so I take I actually take pride in people saying that this is wrong and that those projections were wrong. But it's not about wrong or right. It's that it was our job to prove it that we didn't end up in that worst case scenario. Now we have these new trajectories. We're cautiously optimistic. We finally have time. The enemy has retreated. We can be even more meticulous with our planning and our prevention efforts, because we know that danger is still looming. And until we have a better sense of that, we're going to continue to do this responsibly. Thank you.
And the other projection too that they're talking about, Maureen, is there's going to be a second wave. The people are already talking about the second wave and how do we prepare for the second wave. So.
Okay, thank you. I appreciate those comments from both of you. So this is a two-part question. How many and how soon will Government of Guam workers go back to work? And this reader considers them particularly important because he says they actually have disposable income to buy lunch in his restaurant. And then the other part of that is, would you consider deferring BPT payments till companies have some income?
So the first one is how soon and how many. I would like to make it as soon as possible, but not within the next 2 or 3 weeks. I would also first bring back employees that are more geared towards providing help and support to other businesses. Like, for example, those that do business licenses, permitting fees, land recordation, title recordation, that kind of thing. Those are the people that I would bring back on a very selective and in a very gradual way. Additionally, we are already re-engineering our workspaces to make sure that we still do social distancing we also don't, that there's barriers between us, and also to make sure that everybody wears their mask. The other question was, or your other two-part one was, oh, BPT.
Yeah.
So I have deferred, I have not deferred BPT. I have decreased BPT, discounted BPT for the 3 months, and also so that helps some businesses. So I have not deferred BPT.
Thank you, Maureen. Next is Patty Arroyo with K57.
Good afternoon, everyone. Thank you.
Hi, Patty.
Good afternoon. The large factor on recovery, it seems, hinges on the variable to test those that are least among the community who don't have the resources. So how do you, one, motivate when this large segment that puts preventable healthcare on the back burner anyway? And how do you compel this sector to actually show up to the testing site on Saturday?
Yes, that's a very good question. Thank you, Patty. This is the reason why we want to emphasize that working with mayors and the community that are key, because they know their constituents very well. They know what their needs are. And by working with the mayors, we are able to convince them that, this is something that they need to do, because if we don't trigger those areas that are isolated and they are with no ability to come to the clinic, then they can continue to spread this infection throughout our island. So we really haven't eliminated this COVID-19. And so changing behavior is really key to all this, and educating and constantly bringing out press releases and sending out information. Having our staff at Public Health also do a lot of education by going out and being part of the talk shows and all this and that, and sending out educational materials and doing everything we can to motivate change of knowledge, change of attitudes, and the hardest and the most difficult is change of behavior. And working with individuals that have also recovered and that have shared their experiences of what they went through and how important it is to follow and to go out there to protect not only themselves or to care about themselves, but their loved ones, all those around them. And that's another area that we're working on in terms of recovery stories of all those individuals that have recovered, that are willing to come forward and share their story. And I think by doing that, we can instill some type of behavioral change. And having the mayors to assist us with that, and also the entire community, is key to doing that. And again, it will be in these isolated areas. As I mentioned, it's going to be a pilot project. And then from there, we can move forward in these other areas within the other parts of the island.
So the follow-up then, Linda, will be then, again, this is a segment of our community who largely ignores all of the outreach that you're just now talking about. How are we to ensure that this one variable, which is dependent upon our recovery, will actually be compelled to come and be tested, whether they have symptoms or don't have symptoms?
Yes.
Every opportunity is made available: transportation, location, convenience. How are we just going to tell people in this community that largely, and I hate to say it so bluntly, doesn't necessarily put this as a priority to come to these sites without first of all, knowing, number one, it's free, and number two, there's no incentive to show up other than the government is throwing a testing site.
Right. And that's one of the things that we've been doing over the past years, where the community health centers have always been there. And you're right. So what we've done with that model, it's not a fixed building where the community health centers are there. Now we're getting our doctors out into these remote, isolated areas, partnering with all the different agencies to motivate them. And when you have individuals like what we do, we have like in this particular case, somebody from their own, like an FSM representative, somebody that is like a leader in their areas. For example, we have some individuals in the FSM population that people respect. They can be the key to motivating them, to encourage them, and going out there and not waiting for them to come to us is what we call case finding. And that's exactly what we're trying to do in this pilot project. We're trying to do what we call case finding in these areas that are very isolated. And we can only do so much. And you're right. I mean, whatever we do, and if they don't want the services, what we have to do is just instill and make it known that this is a community threat. And that by getting other people that they're closely related and having them help us to go to them is one way where we can try and motivate them to get some service and accept the fact that public health is out there reaching out to them.
Thank you, Patty. Finally, I-94, Adriana Cotero.
Hello, everyone. So there's been national media reports that the Navy is delaying plans to begin moving sailors back aboard the carrier, and this is coming after crew members have continued to test positive even after isolation. The reports say Navy is temporarily pausing post-quarantine testing and extending sailors' isolation more than 3 weeks. And as we know, the administration is in close contact with the Navy and their operations. So what information can you provide us about this? Will the sailors be staying longer in 2-month hotels for quarantine? And I know that Admiral Manoni had said earlier this week, 2.5% have since tested positive. So has that percentage increased at all?
So, Adriana, I don't know about the percentage, whether it has increased, but I know that they are monitoring and they are testing the sailors, and if they show any positive results, they do take them back to within the fence. If they see any symptoms, they also refer them to the base. As far as the delay, Admiral Manoni did tell me this morning that he had hoped that they would have everyone backfilled into the vessel by this weekend, but the military or the Navy is wanting to keep them for 1 more week. And this is just to make sure that they go beyond the 14 days quarantine, which is the life cycle of the virus, but to go 1 more week, because what they want is to make sure that when they do set out to sea, that they won't have any incidences of coronavirus. That's his information to me.
Okay, thank you. And then for my second question, the Guam Department of Education has served nearly 500,000 meals and counting through their Grab and Go program. And I know you've mentioned federal aid and SNAP, but we know federal assistance can take several weeks to come through. And we also have people saying that they don't even meet the SNAP requirements. So just in speaking with GDOE, they're pushing to continue their Grab and Go meal service throughout the summer. But that would require an additional $1 million of local funding to be budgeted. Does the administration plan to support this? As we know, there's a great need for the service.
Absolutely. I approved a $1 million to DOE to continue on with the food distribution. That's been done 2 days ago.
And just recently also we got funding for $2 million in regards to nutrition as well for the Division of Senior Citizens for food as well.
Thank you.
Could I just make a clear statement about the BPT? Somebody asked me if I was planning to defer BPT. There's really been no discussions about deferring it. But I did for 3 months we did give them I think a 40% in the BPT, but they still have to make it up in future BPT payments. I just wanted to make that very clear. So, closing remarks. Under normal circumstances, we would be celebrating Youth Month young people on our island across the United States and throughout the world have shown immense innovation, bravery, and understanding, and have proven themselves to be capable leaders of future generations. The times we are in are unprecedented, and the youth have stepped up and adapted to these rapid changes. Through humor, empathy, and engagement, they truly embodied what it means to be islanders. Today, I would like to recognize the Wonder Kid Project. The Wonder Kid Project was started by a group of undergraduate students on Guam and in the U.S. mainland. Their goal is to serve our island community during vulnerable situations. As part of their mission, they began a fundraising effort to donate to organizations such as Harvest House, St. Dominic's Senior Home, Guam Memorial Hospital, and any family looking for help. The spirit of our youth is unbeatable, and with their lead, I am confident that our future is in the right hands. In the spirit of Youth Month, I would also like to acknowledge Guam Community College. One day after GCC received its funds from the CARES Act, Higher Education Emergency Relief Fund for college students impacted by coronavirus outbreak, direct payments to the students were sent out. All GCC students who remain enrolled for credit courses during this semester will receive their checks within the next several days. Thank you, Guam Community College, for remaining committed to your students and helping them in this pandemic. Thank you, and Sejus Maki.
Thank you, Governor.